This is your friend Dave. One day, while you're walking down the street with your friend Dave, he all of a sudden clutches his chest and falls on the ground, just like that. The first thing you do is realize he's having a problem. You check his pulse by putting your fingers right here below his neck, and realize he doesn't have a heartbeat right now, and he's having a heart attack. So the first thing you want to do is immediately get someone nearby to call 911 and say your current location and that this person's having a heart attack. Now, after that, what you want to do is, if you have one, you want to take a CPR mask like this, place it on their mouth, and get it ready for use. Second, if you also have them, get gloves, preferably non-latex so they don't trigger an allergy if they have them, and then place them on your hands, just like this. After that, take your hands, place them together like this, with your right hand or your dominant hand over your non-dominant hand, interlocking your fingers. Place them on the apex of the chest, which can be found by drawing a nipple or a line between your nipples and up through your belly button. This is right where the person's heart will be and where you want to place your hand. Place your hand there now and begin chest compressions. 1, 2, 3, 1, 2, 3, 1, 2, 3. You want to do this at a rate of 100 to 120 beats per minute. And every 30 compressions, counting 1, 2, 3, 1, 2, 3, 1, 2, 3. Stop and place your hand or place your mouth completely over the CPR mask, forming a seal around their mouth, and give them a full breath within the span of 1 second like this. Do it again. Place your hand back on the chest again and continue doing chest compressions. After about usually 5 to 8 minutes, first responders will arrive on the scene and take the victim away. All right, it has now been 5 to 8 minutes, and your friend, Dave, is now in an ambulance on the way to the hospital. Now we can slow back down. So far, we have 3 things to cover about CPR, or cardiopulmonary resuscitation, which is what I just did. There are 3 things we covered today. First, an aforementioned CPR itself and how to do it. Second, the history of CPR and when and how it was invented. Third, the current technologies and new advancements that have been made in it, along with the benefits to society that it obviously has on the people. So, CPR, or cardiopulmonary resuscitation, was invented proper in 1960, though it has origins dating back to the 1500s, where people would be sometimes, when they fall unconscious and have a heart attack, they would be whipped, placed in barrels, tossed around, basically just people trying to find any form of way to bring them back. Before this, it was often called just sudden death. Now, when CPR was invented in 1960, the process was a lot similar to right now, where, again, your hand would be placed on the patient's heart, and you would physically beat it for them since their heart has stopped beating. Nowadays, there have been a lot more advancements in CPR technology, including the defibrillator, which is a pair of pads that you place together and shock the victim's heart in certain locations on their chest to send an electrical signal to their heart to continue its beating, along with injecting them with a cocktail of epinephrine and certain other drugs to restart their heart as well. Other inventions to help with CPR have included the CPR machine, which is a robot that can be placed over the patient's heart to do chest compressions in the event that no one is there to do it, or just to do it better than someone else. Now, the benefit to society, obviously, is it's CPR. Without it, a lot more people would be dead right now. unfortunately. CPR has saved thousands of lives, possibly millions, in just the past year alone. And it has a great benefit to society due to that. Thank you for staying here and sitting on this topic. And I hope you learned something great today. Thank you.